Hello, everybody, and welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and I'm the owner of Limbs and Things, mobile and telehealth physical therapy practice. I serve aging adults in DC, in Maryland, and in Virginia, and this is Pull Up with Limbs and Things. Tonight, we're talking about cancer. Do you know someone who has had a cancer diagnosis? Maybe you have been that person. Did you know that physical therapists really work with people who have cancer? A lot of us don't know that. And so tonight we're talking to Dr. Versha Pleasant. She is a physician, board certified in obstetrics and gynecology, and she is at the University of Michigan. And we're going to talk to her tonight. She's also a graduate of Georgetown Medical School. And we are talking tonight about cancer and physical therapy and how the two merge. And so, a lot of things that we discuss in physical therapy are about endurance, about building your strength, about balance as we gain or lose weight based on the cancer treatments that you're going through, trying to maintain a quality of life that is beneficial to you throughout the lifespan. And so, tonight, Dr. Pleasant, we are glad to have you. How are you?
I am doing well. Thank you, Dr. James, for having me on this amazing show. I'm really happy to be here with you all and discuss some really important information for you and your families.
Sure. So, tell us a little bit about yourself and any facts or gems you want to share about cancer.
Absolutely. So again, my name is Dr. Pleasant. I'm actually from Philadelphia, born and raised. I went to Georgetown Medical School, so lived in the DC area for a number of years and did my residency training in obstetrics and gynecology at the University of Michigan and in Ann Arbor, Michigan, and then went on to do a fellowship, which is additional training in breast health and cancer genetics. I am currently a clinical assistant professor in the Department of Obstetrics and Gynecology. And I run a clinic that in which I see hundreds of patients that are at high risk for breast and ovarian cancer. So that's kind of my focus, is breast and ovarian cancer prevention. I just want to clarify to listeners, I'm not an oncologist. I don't manage cancer, but I help to basically address patients that are elevated risk for breast and ovarian cancer, either through a strong family history of breast and ovarian cancer, or patients that have a known genetic mutation that puts them at high risk of breast and ovarian cancer, such as BRCA or BRCA. You may have heard of that before. And the poster child for BRCA is Angelina Jolie. So you may have heard about that in the media at some point. So I want to first start talking about cancer, a little bit about cancer prevention and early detection, and then I want to talk about genetic testing. So a lot of patients come to me and they're worried about breast and ovarian cancer, particularly breast cancer. Breast cancer is the most commonly diagnosed cancer among women in the United States, and the second leading cause of cancer death among women in the United States after lung cancer. So the prevalence of breast cancer is about 12%. So 1 in 8 women in their lifetime will be affected by breast cancer. That's a lot of people. So that means that if you think about 8 women in your family or 8 friends that you have, female friends, one of them in their lifetime will be affected by breast cancer. And so prevention is huge and early detection is really important. So in terms of early detection, there's kind of two things I want people to keep in mind. One of them is mammograms. Mammograms save lives. They're very, very important. There's a lot of mixed messages about when to start getting mammograms, but the American College of Obstetrics and Gynecology, ACOG, which is our group that sets the rules for OBGYNs, recommends starting at age 40. And that is what I'd like to share with you all today. I definitely recommend starting mammograms at the age of 40 and doing them once a year. That's really important. The other thing is self-breast awareness. So you may have heard of self-breast exams in the past. That term is kind of phased out, and now we talk about breast awareness. That basically means that being aware of what is normal for your breast tissue. Lumpy bumpy is usually pretty normal for a lot of women. So your breasts may feel like a pack of rubber bands. That's totally okay. But when you feel something that feels hard, like a marble, pebble, stone, that you can put your fingers around, or that's painful, or that's changing the shape of your skin or causing nipple discharge, those are things that you want to pay attention to, and you want to come to your primary care doctor with those concerns. So that's really important. And then also understanding that cancer is multifactorial, right? It's not just about potentially genetic susceptibility, but also about the lives we live every single day, the things we expose ourselves to every day. So, eating a healthy diet, 4 to 5 servings of fruits and vegetables every day, super, super important because fruits and vegetables have tons of antioxidants, which help to fight cancer. Getting 150 minutes of heart healthy exercise per week. Limiting alcohol intake to no more than 2 to 3 drinks per week. Alcohol is a risk factor for breast cancer, which a lot of people don't know,
Hmm.
and then completely eliminating smoking because we know that there's no sort of healthy or safe amount of smoking that you can have. So those are things to keep in mind. And the other thing that I want to just talk briefly about is family history and genetics. So, 90% of cancers, 95% of cancers happen just by chance. It's just bad luck.
Hmm.
But about 5 to 10% of cancers occur because someone has inherited a mutation, a genetic mutation from one of their parents that puts them at a higher risk of cancer. Hence the BRCA or BRCA that you may have heard of.
Hmm.
So, how do you know if you have something like that? Well, the first step that I like to encourage people to do, sit down with your family, use the upcoming holidays, Thanksgiving, Christmas, to sit down with your family, talk about your family medical history, right? So, yeah, grandma, died when she was in her 40s. That's kind of young. What did she die of? Did she have breast cancer? Did she have ovarian cancer? Things you want to pay attention to: breast, ovarian, uterine cancer, colon cancer, which is on the rise in this country, pancreatic cancer, melanoma, right? Make a family tree and write out all the family members that had cancer, what type of cancer they had, and what age they were diagnosed. And it's really important because then you can have that information, bring it to your primary care doctor, and say, "Hey, I want you to take a look at this family tree. Do you think that I should see a genetic counselor? Do you think I should talk to someone about this?"
Hmm.
So those are really important. Writing down your family history and starting a dialogue within your family about what risk factors may be there.
Good. So
Um,
let me stop you for 1 minute.
sure.
Just wanted to let you know, if you're watching us live, please hashtag live. If you're catching this on the replay, you can hashtag replay. If anything we're saying brings up a question or a comment for you, please put that in the comment section and we'll have Dr. Pleasant to answer it. Okay, go right ahead.
Great. And I want to, Dr. James, I'll let you kind of ask questions. I'll let others ask questions. But, one other thing I want to mention too
Sure.
is I want to make a special plug to the Black community because, um, Blacks are more likely, and regarding breast cancer particularly, Blacks are more likely to have what we call triple negative breast cancer, which is a more aggressive type of cancer. They're more likely to have inflammatory breast cancer. They have a greater chance of dying from breast cancer if they are diagnosed with it. They're more likely to be diagnosed at younger ages with breast cancer, like under 45, more likely to have male breast cancer. So, in this population, the reason why I mention those things is because prevention and early detection are even more critical in this population.
Mhm.
And so, I want us to really think about that and be very aggressive about how we prevent and manage disease before it happens.
Those are definitely factors that we don't think about. So thank you for sharing those. Okay, let's see what questions we have. Hello, Brandon. Let's see. CSF says, is it better to have 3D mammograms?
That's a great question. So 3D mammograms, you all may have heard of this before. 3D mammograms, you may have also heard of like the term tomosynthesis, right? So this is mammogram is basically an X-ray. So it's taking a picture of your breast in sort of 2 dimensions. But the 3D mammogram, as its name entails, is actually not only taking the mammogram, the X-ray, the way it was typically performed, but it's also sending an X-ray beam over the breast to recreate a 3D image of what your breast looks like. So while 2D is still technically the standard of care, I do like to encourage patients to talk to their physicians about getting a 3D mammogram. And the reason why is because um, radiologists are the ones that they're the doctors that look at and interpret the mammograms. And having a 3D mammogram gives the radiologist a lot more data and information on your breast tissue than does a normal 2D mammogram. I like to use the example of, having a video of something versus a photo of something, right? And so a video of something might give you more information about kind of who's around, who was there 5 minutes ago, how the lighting was, how things looked, right? But a photo is just taking one snapshot and you have that to work with. So again, for instance, if you have a 3D mammogram, there might be something that they see on a 2D, but then with a 3D, they can go back through it and see, oh, is that a mass? Is that, oh, no, that's their normal breast tissue. Or, oh, something that looked like normal breast tissue now looks like a mass, maybe on 3D mammogram. So it's just another data point. I like it. I think it's a great tool. And again, it's something that you want to talk to your physician about.
Very good response. I like that analogy.
Mm-hmm.
I want to pause and talk to us a little bit about physical therapy and how we tend to help people to know like when to seek care that is outside of our scope. So with PT, we are usually talking to people a lot, and they tend to tell us about certain areas of their body, and they'll say, "Well, I had something that was over here, but I wasn't sure, how it's growing." And so some of the things that we tend to say is looking at the ABCDE of cancer, whether there's any asymmetry with a mole or a different spot on your body, looking at the borders of it, if it's irregular or not, checking the color, if the color is changing, and then looking at the size of it. Is it growing? Is it staying the same? Is it evolving from what you've seen before to now? And so that's just something to consider if you are even thinking about the need for seeking assistance and knowing what is this on my body. So can you answer for us if you notice that something is awry from an ovarian point of view or breast cancer point of view, who you should see first?
That's a great question, Dr. James. So, and because you mentioned the ABCDE regarding melanoma, because my focus is very much breast and ovarian cancer prevention, I want to talk a little bit about warning signs there too, um, because they present a little bit differently, obviously, than melanoma. So, breast cancer, the things you want to watch out for are a mass that you're feeling on your breast that's new,
Mhm.
or growing. Any changes to your skin. Sometimes, if there's a mass under the skin, it can pucker the skin or dimple the skin. Can change the shape and appearance of the nipple. Any nipple discharge that you're noticing, back pain that you're noticing, but it should also be noted that sometimes people can have breast cancer and they don't have any of those symptoms, right? So
Mhm.
those are just some of the symptoms that they could present with, and that's why mammogram is important to get, because mammogram can see things that we don't necessarily feel on exam. In terms of ovarian cancer, some of the warning signs you might see are things like bloating, abdominal pain, nausea, vomiting, feeling like you get full quickly when you eat,
Mhm.
changes to bowel habits or bladder habits. Those are things to watch out for. Or if you notice that your abdominal girth is growing and you don't know why. Now, a lot of people will say those are really vague symptoms. How do I know if I have ovarian cancer?
Mhm.
So yes, they are vague symptoms. I would say if those symptoms persist and you don't have another reason for them, those are reasons to go to both your primary care doctor or your OBGYN. Those are probably the two best people to go to if you're having any breast symptoms or any pelvic symptoms.
Okay. With ovarian, is there any discharge you would see out of the normal?
If you had any abnormal discharge, I would recommend that you go see an OBGYN to be evaluated.
Okay.
Yeah. So any abnormal discharge, that's something that warrants evaluation.
Okay.
Mhm.
There's another question from Brandon. Medical science has improved tremendously, but why is there not a cure for cancer?
Oh, what a great question. Um, I love that question, and that's why I love the work that I do, because it never ends, and there's no easy answer to that. Part of why perhaps there isn't a cure to cancer is because cancer is so complex. So again, I see women with genetic mutations, a lot of them who have genetic mutations that put them at high risk for cancer.
Mhm.
But it's not just about your genes, right? There's this very intricate and complex dance between your genes, what you got from your parents that you can't control or can't change. But then there's also an interaction with your environment that you live in, right? Do you smoke? Are you around people who smoke? What are you putting in your body every single day in terms of food? What chemicals are you exposed to? Are you getting enough sleep? Are you getting enough exercise? So um, no one, unfortunately, with all of the advances that we've made in science, no one can say for sure which one of those factors has a more important role, and maybe none of them have the most important role. Maybe all of them play a role together in creating cancer. We're still looking for the answer to that, but that's an excellent question. And I think the best we can do is what we're able to do, which is control the way that we treat our bodies on a day-to-day basis. Again, by the foods we put in our body, the exercise we get, and trying to stay away from things that we know are not so good, like tobacco and excessive amounts of alcohol.
Mhm. Good response. Let's see. Follow up to the 3D mammograms. Is this covered by insurance?
That's a great question. And most insurance companies, to my knowledge, and again, this is not necessarily I don't work directly with the insurance companies in that regard, but I have not seen an issue so far with a patient having coverage for a 3D mammogram. So if it's something that you think you want, it's definitely worth talking to whatever provider writes the order for your mammogram. So this might be your primary care provider, this might be your OBGYN, your family doctor, your internal medicine doctor. I would talk to them about it, talk to them about the benefits of it.
Mhm.
Understanding also that there's a slightly increased risk of radiation. So there's a little bit more radiation with the 3D mammogram, but not so much that we think that it greatly increases your future cancer risk. So, but I want patients to also be aware of that.
Okay. Good point. If you are watching and you have a question or a comment, please put it in the comment section. Here's another one. What about blackheads on the breast? Is that normal? If it's rare and intermittent and has never been detected with a mammogram.
Yeah, so it kind of, I would say that, you can have blackheads on any part of your skin. But I would still, for blackheads that or recurrent blackheads or bumps that you're getting on your breast tissue, I would still have a physician do a thorough examination of your breasts to make sure that that's something that's just superficial on your skin, something that's benign, and not something pathologic that's going on underneath the skin. So, so yes, it is. There is skin on your breast, and skin there can be lots of different manifestations on the skin, but still something to bring up to your physician and have them check it out just to make sure.
I have a question for you. In terms of chemotherapy treatments or radiation treatments, are there any ones in particular that you feel are more beneficial overall to your quality of life in terms of being able to go about your daily activities?
In terms of chemo and radiation,
Hmm.
I probably will defer that question to an oncologist because they're the ones I don't actually order chemo or radiation for the patients that I'm seeing. But what I will say, though, because Dr. James, you do a lot of rehabilitation, that I see a lot of breast cancer survivors come through my clinic for gynecologic care.
Uh-huh.
And the ones that do see a physical therapist tend to manage a lot of their symptoms a lot better, particularly those who have maybe had radiation before, those who have lymphedema issues, find um, physical therapy very beneficial to them. So it's something that I would recommend that any person that's going through chemo or radiation, that they get linked in with a physical therapist or talk to their oncologist about physical therapy and what that could provide for them.
I agree. Okay, is there anything else that you want to share as like a final thought for us? Oh no, before you do that, we have another question.
Oh, sure.
Can cancer appear anywhere in the body? Just wondering because you never hear anybody say I have toe cancer or finger cancer.
Yeah, that's a great point. But yeah, theoretically, cancer can occur on any part of the body. Cancer of the finger, cancer of the toe. So I actually have heard of those before, and ironically, people can get melanoma of under the nail bed of their finger, can get it on their foot, the bottom of their foot, their toenail. In fact, Bob Marley actually died from melanoma. He had melanoma on his foot. And so, yeah, absolutely. So you can get it pretty much on anywhere, any part of your body. And that's why it's a really important reason to Be constantly monitoring any changes of your skin. Anything new or unusual that you're noticing painful, you want to talk to your doctor about that.
Most of the patients who I have seen with cancer, they in their advanced age, say over the age of 70,
Mhm.
have you noticed that there are any differences in how um, they're detecting cancer as opposed to an older person, a younger person, excuse me?
Yeah, well, particularly in the population that I work with. So again, I work with people who are high risk for breast and ovarian cancer.
Mhm.
So age is a risk factor for both of those cancers. So as we age, we have a higher chance of getting breast cancer, and as we age, we have a higher chance of getting ovarian cancer. So for a lot of cancers, that is kind of the rule of thumb generally is age tends to, and there's a lot of reasons for that on a molecular level as to why age makes us more susceptible. You could also argue that, yeah, we're detecting it more in older people because older people are the ones who get screened, right? We don't do mammograms on, 10-year-old girls or 20-year-old females, right? And we don't do colonoscopies general for most people, with a rare exception of people that have certain mutations, but we don't do them on, say, 20, 30-year-olds, right?
Hmm.
So we're more likely to catch them at older ages because those are the people doing the screening, but also more likely to potentially have cancer at older ages because that's just a risk factor for it.
Hmm. So
But
if
again,
Go
yeah,
ahead.
go ahead. Yeah, but again, I still want to make a plug here for, and this is, I'm just going to throw this out there as one of my final thoughts. Really, really important for you to sit down with your family members, right, and talk about cancer, talk about your family history. For a lot of families, this is very taboo, or people, don't want to discuss death and disease. But it's so important for your health. It's important for the health of your siblings, your parents, your children, and you could be a young person, but be at risk for getting cancer at a younger age, depending on your family history. So sit down with your family, make a family tree, write all those cancers out, and bring it to your primary care doctor and talk about it and see if you're eligible for genetic testing. And then if you do have a particular mutation, they can talk with you about different management strategies, how to detect cancer earlier or to decrease your risk of getting a certain type of cancer. And then also what your other family members' chances are of getting that same mutation.
Okay. You mentioned a genetic counselor earlier. How do you get in touch with a genetic counselor?
Yeah. So a genetic counselor, typically, there's kind of two ways you can get in touch with a genetic counselor. The first way is through a referral from your primary care.
Hmm.
And so if your primary care, say, looks at your family tree and says, wow, you have a lot of breast cancer in your family. Your grandmother had it, your mother had it, your aunt had it twice. Um, they will be the ones to refer you. So you can ask for a referral or they will refer you based on the information you're giving them. You can also self refer. So there are some patients that actually can directly contact a genetic counselor and talk to them about family history without a referral from a primary care. You might want to check with your insurance company and see what the rules are about that, because I think there's a lot of variation there. There's also some variation regarding what insurance companies will cover. Sometimes they will not cover testing and counseling, rather testing if you don't meet the criteria. Although that doesn't mean you still can't get tested. People that are curious sometimes about their genome will still get tested and potentially pay out of pocket. So you just have to ask your insurance company what's covered.
Okay. Well, I thank you. I think you've shared a lot of information that will help not only those who are watching, but someone else who they share this information with. Every pull up with limbs and things is to confirm something you know, to challenge something you don't know, and to be able to share that information with someone else. So we thank you so much for joining us. Is there anything else you want to share as a final
No, go out, get your mammograms, write your family history down, talk to your primary care about it. Those are my 3 points. And Dr. James, I feel so honored that you had me on today. I'm really, really happy to be here. And thank you all for listening.
Sure. Thank you. I appreciate you. Everybody have a good evening. Bye.
Take care.